Welcome to the first webinar in our new webinar series. Before we begin with Dr. Alaggia's talk, there are a few quick housekeeping points. For participants who are listening in French, on the bottom left of your screen, click Floor and select the language you'd like to listen in. To see and follow along with the PowerPoint, on the top left, click PowerPoint so you can follow. You can also download the slides in both English or French and follow along by clicking on Documents on the right. At the end, we will have a 5-minute question and answer period. You can type in your questions by clicking on Messaging on the right and then Participants. I would now like to introduce you to Dr. Ramona Alaggia from the Factor-Inwentash Faculty of Social Work at the University of Toronto. And I'm going to pass.
Hello, everyone. It's Ramona Alaggia, and I'm just so pleased to be with you here today, talking about facilitating sexual abuse disclosures, what everyone working with children and youth needs to know. I just wanted to mention initially that my work has been informed by decades of experience in the field of children's mental health, and my original training was done probably 25 years ago in sexual abuse, treatment, assessment, and treatment. So I am so pleased to be talking about disclosure and disclosure facilitators and barriers. Excuse me, I'm just having a problem moving to my next slide. We'll just get that sorted out. While we're waiting for the slide to come on, I'm just going to talk about the objectives for today's talk, starting with covering how common is withholding of child sexual abuse disclosure, how common are delays, what are the barriers, what are the facilitators, using a trauma-informed framework, and questions to ponder for your practice. Oops. Okay, I think we've got the slides now. Unfortunately, the literature shows us that the problem of withheld and delayed disclosures persists and has persisted over the last 2 decades. The most recent reviews show us that 25 to 50% of children deny sexual abuse even when there is the presence of a sexually transmitted infection or when there's actual video evidence. So the tendency is for especially young children to deny that sexual abuse is happening or has happened when there has been concrete evidence. In quantitative and qualitative studies, we find that up to 80% of child sexual abuse survivors report withholding disclosure until their adulthood. So these are retrospective studies of survivors who have talked about their disclosure experiences. And 80% is probably a conservative amount. It'd be closer to 90% when you include all studies. And in studies of children and youth who have recently disclosed, we find a broader range of about 50 to 80% of children delaying disclosure, and that occurs on an average of 1 to 4 years. I will be talking a little bit about the project we are currently running out of McGill University, the University of Toronto, and Dublin University College in Ireland, where we are looking at interviewing and have been interviewing youth who have recently disclosed. We have about 30 participants in our study, and we're finding that this average can actually range from 1 to 8 years of delayed disclosure. There are 3 main models that have been developed around how disclosure occurs. There's the one that I developed in 2004, Many Ways of Telling. Stoller and Nelson Gardell's disclosure process description, and McIlvaney and colleagues containing the secret formulation. These are important models for us to rely on when we think about how children and youth disclose. And there are commonalities through these three models. I won't describe them in detail, just for lack of time, but the main threads or the themes throughout these three models are that this is very much a process-bound process, a process-bound lifelong process. That means that there is not a one critical event disclosure, that it occurs over time, that it occurs in stages, and depending on factors such as age, gender, other contextual factors of family, proximity to the perpetrator, this will determine how long this disclosure process will actually unfold for. So that to expect a spontaneous, clear-cut, consistent disclosure from children or youth is probably an unrealistic expectation. These disclosures manifest in many different ways and over time, and often within a close, trusting relationship, which takes time to build. Recently, we had a comprehensive review come out, published in Trauma, Violence, and Abuse, looking at over 30 studies and trends in disclosure. And we found a number of interesting and important trends for practitioners to be aware of when thinking about disclosure. First of all, disclosures tend to increase with age. That's not surprising, as cognitive and developmental capacity increases with age and the ability to tell becomes more optimal. Boys are less likely to disclose. We're not sure why. We probably think it has something to do with cultural constraints, with views of what it means to be a boy, that boys are not viewed as victims, or that being viewed as a victim is seen as feminine, undesirable, but we do know that boys are less likely to disclose. We also know that disclosures are much more likely when the perpetrator is in close proximity to the victim. This is not a new finding. The closer the perpetrator is to the victim, both physically or in a relationship, the less likely that a victim or survivor will be confident to or feel safe to say anything. And clearly we have developed policies around this type of finding so that we remove perpetrators from victims when there is a disclosure or when there's a suspicion of disclosure in sexual abuse. We also found in literature that families with open communication and social supports increase likelihood of earlier disclosures. Unfortunately, the trend that adolescent females are less likely to be believed and more likely to be blamed is a fairly stable finding. And we know that patriarchal societal structures impede child sexual abuse disclosure, as with the example of boys who are less likely to disclose because of not wanting to be associated as a victim. One of the pieces of work that I've been involved in over the last 15 years and continue to be involved in this new project is that we are looking at the different types of disclosures, the ones that we've established in the past and the ones that are emerging in our new data. And we tend to think of disclosures as purposeful, where there's an intent, there's a plan to disclose. Accidental, when there's been third-party discovery, somebody's witnessed it, or perhaps there has been a positive STD test. those tend to be accidental and not initiated by the actual child or youth. Lately, we've also been looking at behavioral disclosures where the disclosures are not verbal, and our new data is certainly confirming this, that the disclosures happen through actions, through ways that children or youth behave to show that there is something wrong, and then also with symptoms that emerge due to the trauma that has been experienced. Another type of disclosure is one that's elicited or prompted, and that is when there is a suspicion or a caring adult is concerned and starts asking questions to perhaps open up the child or youth to telling them what is going on. And these tend to be problematic because that kind of evidence in court is not valued and is tended to be used against the victims or the therapist or professional or caring adult that has prompted it, to ask about it, and then may be accused of leading the child or the youth into a disclosure that may not have veracity. In the research that I've been doing, we also notice that there are triggered disclosures where there has not been a memory, the memory's been repressed, but perhaps has been then precipitated by another event, intrusive thoughts, symptoms, perhaps a life event where the birth of a child can sometimes trigger the disclosure of previous sexual abuse. One of the types that we're discovering in our data as it's emerging is this progressive, which is similar to purposeful, but is very much measured by the person who's being abused in terms of letting out a little bit of information, seeing what the response is, and then perhaps retreating if there isn't a positive response or if they don't feel safe. They sometimes offer hypotheticals, and you've probably heard when people present a scenario saying, you know, I have this friend who is experiencing this problem, and they're really talking about themselves, but they want to see how somebody is reacting to what they have to say and what they will do about it. And depending on that reaction, will either move forward with more information or will retreat and perhaps take a pause on disclosing or try with somebody else. And finally, the one that we have noticed as well with the interviews that we've been conducting is that there's the naive disclosure where especially younger children may say what's going on but have no idea that it's sexual abuse. So that they will give information like, my uncle was showing me pornography on the computer, or people kissing and touching each other on TV, and not having any idea that that is exposure to or part of the grooming process. When looking at the available research and through conducting our current research, we've noticed certain precipitators to disclosures. One of the themes that's come through in our interview data is that often participants give the reason for disclosure as it was getting worse. They couldn't take it anymore. They were concerned, they were fearful, and especially around puberty, the fear of pregnancy, and an escalation of the abuse. Realizing that the abuse is not normal. So sex education and a good sex ed curriculum really is one precipitator for youth to say to themselves, geez, this is happening to me, and now I know it shouldn't be happening to me. So we really cannot underestimate the value of early sex ed and any kind of forums to educate young people and young children as to sexual matters, their body parts, what's normal, what's good touch, what's bad touch, and beyond that. So that information about abuse and what to do about it, like school assemblies, prevention talks, are certainly things that the youth are telling us in our interviews really help them to find ways to talk about the abuse that they've been enduring. Another precipitator was their descriptions of increased problematic symptoms, especially around anxiety, suicidal ideation, disordered eating, so that they were unable to manage these symptoms and maybe coping behaviors that had worked for them before but were no longer working for them, that they started to find or access trusted adults that they could talk to about this. Increased school performance for a number of our participants in the research study was another reason to disclose, so that at some points they were using school to escape, to retreat away from the abuse or reminders of the abuse, but at some point their symptoms or other things came into play, so now that their school performance was decreasing, and that was very troubling to them. The availability of supportive adults cannot be underestimated. This theme came through over and over again in the interviews that we've been conducting, so that an extended family member, somebody at a school, a trusted adult, became so important as a source of who they could go to and tell about what was happening. And again, in this kind of progressive way, so that it wasn't one contained statement, that it happened over time, but that they knew that they could keep going to this person and keep telling their story in progressive ways till finally they were able to tell the whole of their story. So I really wanted to talk about today, because there's so much research on the barriers. We can look at it, overview of the literature, and see lots of reasons why children and youth do not tell. So we were really interested in looking at what are the facilitators that really help to tell. How can we start to pinpoint those and detail them so that practitioners can actually walk away and know what kind of environments they can create in order for young people to feel safe to tell about sexual abuse. So again, both in the literature and through our current research, we're finding very strong evidence to indicate that children and youth are more likely to tell, to disclose, in a dialogical context. And what that really means is in a trusted relationship, a dyad, where that could be a formal helping relationship or informal supports. They are least likely to tell in a one-off where perhaps they're being asked by a clinician in a checklist type of situation as they go through their list of, has this ever happened, has that ever happened, and if one of the items is, have you ever been sexually abused, the chances of a disclosure at that point are very minimal, because there isn't the relationship, there isn't the trust and the safety that's been built up to be able to feel comfortable as much as one can in disclosing sexual abuse. As I indicated earlier, disclosure is a process, so that time is a really important factor, and giving adequate time for disclosures to emerge is so critical. Now, we can see that as potentially being problematic given the paradigm of service provision that we are in today, where a lot of services are offered in brief formats, time limited, session limited, and this sort of flies in the face of what evidence tells us, which is that disclosure is a process, that it does take time, and that the young person, the child, has already been betrayed, they've been violated, they are really in a relational dilemma because they have been abused by a trusted person, and then they need to build trust with another person to be able to tell, and that is going to take certain conditions and time for that to occur. So that one of the things our research has pointed us in the direction of is that environmental factors with families and in schools is so important. I particularly mention in schools because children and youth spend a good portion of their day, their time, and their lives in schools. So that the environment for disclosure is really important in the school setting, and we know with families where there's close, trusting, open communication. And so let's talk about family environment. Again, these points come directly from our data in the interviews, where there is clear evidence through numerous statements across a number of interviews that a close relationship with mothers and open communication in the family is so important. Now, it may be that mom is important because in our sample where we tend to have the majority of sexual abuse victims as intrafamilial cases of sexual abuse, and that the perpetrators have been male, either the father's biological father's, mother's partner, a boyfriend, so that the mom becomes very important in terms of who that child or youth can tell. And that this open communication in the family is a characteristic that has been embedded in the value system of that family. So that examples that our participants gave us was that things like we could talk about anything, that we could talk about sex and that was all right, that we could use the language that we needed to, and our parents or our mom wouldn't judge us or scold us for it. So that a particular type of communication pattern in the family was very important. And that it starts early, that it starts young, that secrets are not held in the family, or at least that secrets are explained in terms of there's good secrets when you're going to have a surprise birthday party versus bad secrets when somebody's hurting you and they're telling you not to say anything. So that this kind of access to language, to not being judged, to being able to ask questions that are embarrassing, to be able to say things that might be difficult became really important factors in those families where the participants in our research study were able to tell a relative and including their mother. Families in which children were encouraged to talk about all sorts of experiences and feelings contributed to disclosure. So again, we heard our participants saying things like, we always had a time during the day, whether it was before dinner, after school, before dinner, that there was a set time where there was time set aside to be able to talk about what was happening in their day, that they were encouraged to talk about these things and feelings. And while this might seem like common sense, often what happens is children don't have the language to say what happened. You often get an answer like, everything's fine, it was good. And it seemed like the parents that they were describing who were able to, disclose to, went beyond that and really talked about, so what was good about your day and what was not good about your day, and give examples, and would use facilitators for feelings, whether it was a mood chart or something like that, to help kids connect their feelings to words. Again, disclosures increase when perpetrators no longer reside with victims or are no longer in close proximity to the victim. And, this is a tricky point because perpetrators go to great lengths to hide what they're doing, to disguise what they're doing, to groom their victims not to tell. So that often a period of time has gone on where the abuse has gone on, the perpetrators had access to their victim, and this has resulted in delayed disclosure. So again, this is a conundrum which practitioners need to really be thinking about. How do we deal with this when the very reason that child or youth will not disclose is because their perpetrator is not only in close proximity, but ensuring that they remain in close proximity by masking, by denying, by often grooming their victim in ways so that they don't say anything. I cannot stress how much the school environment came up in our interview data as being a source for those youth who disclosed to have a positive experience and one that led them to be able to be freed from the abuse that they were enduring. So often the narrative went like this, that a youth was given information or education at school on topics of sexuality in general, but also sexual abuse as they got older more specifically. And around middle school, grade 7 and 8, seemed to be a critical period of time that our participants referred back to, that they finally figured out that what was happening was not okay, that in fact that they were being abused, and they were given options of what they could do about that. So we can't underestimate the impact that these information sessions, this kind of sexual education, is having on those kids who are enduring sexual abuse to disclose. So any kind of raising awareness and prevention programs can promote disclosures of sexual violence committed against children and youth. Yet we're also in the paradigm or era of education where educators are feeling more and more stressed and more put upon to do things outside of their role as educators. They're being asked to be children's mental health workers, counselors, and I say this because in certain jurisdictions that I've come in contact with or consulted to in educational forums, disciplines such as social work have been cut back by 50% in certain school boards, so that those resources of social workers are no longer available to youth who want to disclose or for teachers to refer to. That is being now offloaded and downloaded onto guidance counselors or teachers who take an interest in their pupils. And there is a sense or a feeling that, in fact, the school environment is not where disclosures should be happening, that they cannot be managed, the capacity is not there, yet it is the very place where many youth feel that it can be a resource they feel connected to and have relationships with. So just when we are getting these data that suggest that school environments are so important, our funding formulas and our socio-political contexts are dictating that these resources are very stretched. Of course, because our sample in 2 of our sites came from child and youth advocacy centers, so that we got referrals, recruitment from those services, we become more and more aware of how important a therapeutic environment is and how well these centers are working. So that having the support of a child advocacy service that is child and youth friendly, uses age-appropriate language, uses child name, eye contact, all those things they're trained in to help a supportive disclosure, are being reinforced in our research as working, as being really important, as doing the things that are the most helpful for youth who are somewhat reluctant or ambivalent or even ready to make a disclosure. Making those settings as non-clinical as possible, even though they're staffed by highly clinically trained people, when they don't look like a doctor's office or a psychiatrist's office or a hospital setting, really, really helps to facilitate disclosure and positive outcomes. Again, as I mentioned, these on-site counselors in schools are so important, where a therapeutic environment can be promoted. So some of the things that our research participants have talked about and tell us that as much as these therapeutic environments, and they weren't calling them therapeutic, but they were calling them places like safe houses or safe places, or people that, for example, police are not in uniforms. As much as they were telling us that those things were really helpful, that there were a few things that they found to be difficult. And in the course of the disclosure, one of those things that came up was that they had to tell their story over and over and over again. And they had to do it in a concentrated period of time. So if you remember the disclosure models that I reviewed earlier and the commonalities that make those disclosure models effective, one of them is a process, and process takes time. Another thing is having a trusting relationship, yet they were disclosing to a trusted person and then being handed over to a team, a well-intentioned caring team, but then have to tell their story again to somebody perhaps that they did not know. And then again to the police for a statement. And it needed to happen within 12 hours or so that often they were taken out of school and immediately taken to a center, and then interviewed by a number of different people, perhaps also given a medical exam, and again, more questions. And I'm not sure what to do about that, but they did reflect that as being very trying. And the other thing they reflected was that a number of them did not know that by telling their social worker at school or a teacher or even a friend who would tell a parent, that it would set off this chain reaction of events that would include a child welfare investigation, a police investigation. And so that was difficult for them to suddenly realize that they couldn't take back what they said. And I'll talk more about what the final kind of outcomes of that were, but that process is important for us to note how difficult that is on the youth, even though we've created these therapeutic environments that really has helped to create more support for disclosure. So some of the strategies that are mirrored in the literature, but also were given to us by our participants in the study, is, asking them if they could, it would be easier to draw than to tell their story. With younger children, to employ anatomical drawings to identify where something happened on the part of the body or what the offender used. Uh, One of the suggestions was asking them if they would prefer to write the answers to your questions. So I was kind of surprised at that in fact they did find that as something that was either helpful because they had experienced that, or they suggest would be helpful for future practice. So this leads me to thinking about another kind of paradigm shift in our services that's occurring and is highly, highly compatible to child sexual abuse disclosures. And that is looking at services and programs and ensuring that a trauma-informed approach is being used and creating trauma-informed environments as best as possible. And for some folks, that would be already something that's being integrated, has been integrated, and services reflect that. But we're not seeing this in, let's say, school settings where we're hearing that that's where a lot happens, and that is a site of potential disclosures. And what does that mean? And not all services are aware about creating trauma-informed environments. And some may feel that they already have those in place, but in fact, it's not to the degree that is indicated by how difficult it is to disclose sexual victimization. So I turn to the work of Harris and Follett, who really developed the model of trauma-informed care, trauma-informed practice in service organizations. And when I work with agencies, when I work within my own practice, or when I'm teaching students for preparation for clinical practice, I say, that to really understand if you are working within a trauma-informed perspective, you need to be following certain basic principles. And I always return to this because as much as we think that we're doing this, sometimes we think we are, and it's not really how our clients are reading our services to be this way. So of course there are 6 principles. If you're not familiar with them, is in every aspect of the organization and service delivery for everyone who is involved in that service, and not just clinicians, and not just the administrators, but also the receptionists who greet folks at the door, for those who service the building, for everyone who is involved in carrying out that service or supporting the carrying out of that service, that we look at these 6 features: safety, trust, choice and control, collaboration, empowerment, and being strengths-based. Again, this may seem like common sense, but as we were going through our data for this particular disclosure research, what may seem like safety for one person may not be safety for another person. Or if we look at sort of the 3 C's, choice, control, and collaboration, just by virtue of the fact that when a minor, when somebody under the age of 16, or now it'll be older, but is disclosing, that immediately choice is compromised for them and control is compromised for them, because that report then needs to be made to child welfare authorities, and rightly so, for their safety, but perhaps they don't read it that way. And as I mentioned, safety for one person might be something very different for another person, and especially when choice and control is compromised, then what does one do? How is one interpreting how trauma-informed their service really is? So, for example, one of the things that we would say, like, to the participants in our research study, so what would you recommend based on this feeling that you lost control, you lost the ability to choose? And often they might say, well, there was really nothing you could do about it, it just needed to happen, and whatever. But some would say maybe if I'd known ahead of time what was going to happen and it was going to be predicted. And even though professionals are very good about telling, youth about the limits of confidentiality and reporting to child welfare authorities and police, I didn't really know what that meant, or under what circumstances or what would happen. We had one participant in particular, though, sort of our negative case analysis, where she went on the internet and she read about what would happen if she disclosed, and it made it very clear to her that child welfare would have to be involved, or the police would have to be involved, and perhaps her family couldn't stay together. And that actually resulted in a delay in her disclosure of about 3 years, and it wasn't until her symptoms became very, very troubling that she then said what was going on and disclosed the abuse. So it's, again, another interesting conundrum. We want to work collaboratively, but on the one hand, we will say to our client, we'll keep confidentiality unless you tell us this. And how do we work collaboratively? So while these may seem like common sense principles, in fact, they are difficult to deliver on, and I would recommend that every service take an inventory of what they do and really examine how these 6 principles can be shored up. And it's not that it is even able to be possible to do all of these all of the time, but often there are loopholes in the services we provide that can be shored up. Part of the other work I do, and I just want to give an example around this, is I work with domestic violence survivors. I work with women who flee abusive relationships with their children, and do a lot of work in terms of creating trauma-informed environments and shelters. And I was working with a shelter not that long ago, and which, and if people know about shelters, often they have video surveillance cameras outside their doors. They're put there for safety in case a perpetrator discovers where his family may be staying and poses a danger that this is a locked door, there's a camera. And often the staff meeting room or the reception room is encased in glass, and there's sort of a speaker, sort of like when you go to the subway that, you ask for your tickets, but you ask for your appointment or to visit somebody. And although these measures seem to be put in place to really protect very vulnerable clients, refugee families had a very different reaction to walking up to a facility where there's video surveillance, depending on what the context for their leaving was, if there were war conditions, if police were not to be trusted. And so the actual housing of that shelter becomes has a very different meaning for folks who are coming from war situations where trauma has to do about who you can trust, whether you're being surveilled, whether you're being videotaped, what it means to talk to police or anybody in uniform. So that was a good learning lesson for that shelter staff, the service, to think, well, what do we do? We still need to, it's like, we can't remove the cameras. Like this, it's important that this is still in place. But maybe what's important is explaining to families why that's there and why it poses a safety feature rather than a threat. And so the then protocol for how a family being admitted to a shelter changes based on a different kind of an orientation. So that's just one example of many that we could probably maybe be thinking about. But again, what might be safety for one person might be threat for another person. And so in disclosure, taking an inventory of your services, of how those are delivered, what that looks like. I had one participant say that she was interviewed in a room that was child-friendly, but had a lot of teddy bears. And all those teddy bears that for one child might be comforting and reassuring, for her felt like a lot of eyes on her. And she said it was creepy. So again, and I happened to know that room, and I happened to have been in it, and from my point of view, it would seem a very child-friendly room with lots of teddy bears and lots of plushy toys. But from her point of view, it was creepy. So it's hard, we're never going to get it right, but doing this kind of inventory and really examining where these principles can be tightened up, where they can be shored up, where more safety can be provided that builds trust, that helps empower people, and is strengths-based, is certainly a good exercise to venture into. I think I'm probably missing a slide, but one of the things before we move on that I wanted to mention was that we had a whole theme area come out in the end when we asked a final question of all our participants. We asked two questions. One was, if you could do it all over again, would you do it? Or how would you do it? Would you do it differently? And what advice would you give to other youth who may have not disclosed but are thinking about disclosing? And the vast majority of answers were, it was hard, it was difficult, it was painful, but they would have still done it again, and they would strongly encourage others to come forward because the abuse stopped. And even those situations where families were disrupted, there was still a feeling of it needed to happen, and that they really strongly recommended that youth come forward and disclose. So there's something about their disclosure experience. And I would say I probably interviewed about 12 of those, and I would say only in one case did somebody say if she had to do it all over again, she wouldn't. But they felt it was the only way of moving forward and getting the help that they needed and that their family needed. As I indicated before, many of these cases were intrafamilial, although some involved also extrafamiliar. So it's interesting that we still see that kind of pattern, that being sexually abused within the family also increases the risk for sexual abuse outside of the family. But many of them had their initial victimization within the family or with a family-like member as the perpetrator. I think also one of the benefits that they mentioned, again, this was a strong theme, was it got them into services to be able to get therapy for the help that they needed. And if you remember some of the precipitators that that showed through in our data, was that their symptoms had gotten really, really bad around anxiety, depression, suicidality, not being able to eat or sleep. And so getting the services and getting the therapy to them was really a huge positive outcome. And they gave, great examples of learning cognitive behavioral techniques to help with their anxiety. There were certain methods that were used by therapists that they mentioned very specifically. I think of one called lavender rice, which is sort of a calming rice that's got lavender scented, that they would, put their hands in and kind of at anxious moments be able to soothe themselves through that they learned techniques that they could take away. Because once the disclosure happened, it did not mean that their symptoms or their behaviors decreased. And in fact, in some cases, things got worse, but they then had the support to go on to service to get the therapy that they needed, and also for the family to get the therapy, the service that they needed as well. So I just wanted to point that out, that I really, given the kind of issues that came forward, that there were problems, unexpected, chain reactions, loss of control, loss of choice, they still, in the end, said it was the best decision that they had made to disclose so that it's over with, so that this fear of becoming pregnant, that the escalation of the abuse, that all those kinds of problems were then able to be put out in the open and dealt with. So I think I'm coming to the end of my PowerPoint and my talk. And so, I wanted to pose a few questions for you to think about, not just now, but perhaps as you walk away and as you go back to your services. What do you do that is working in disclosure of child sexual abuse? It's always good to identify those things that are working so that you could keep doing more of that. In listening to this talk or thinking about your counseling experiences, what facilitators for disclosure have you identified? Maybe there are things that you could be doing that you aren't doing. Perhaps your service or program could be more trauma-informed in ways that you haven't thought of. So I leave you to ponder these questions, but I also open it up for any kinds of questions that you might want to pose through the chat, which is the messaging feature on your screen. So as you think about that and you want to put up your questions, I'll read them out and try to do my best to answer them. I don't see any questions coming up. Okay, we'll give it another half a minute or so. I know folks might be typing something out. Okay, we have one question. Thank you. What sort of interview models or techniques do you use and why? That's a great question. There is, I think, through the SAMHSA in the United States, a study that was done, a highly funded study on forensic interviewing. And forensic interviewing tends to be the model that's the most researched. And what they're finding in that evidence is some of what I already posed, that child-friendly environments, using different methods of drawing, writing, dolls, those kinds of things really help as techniques to facilitate going slowly. And I think that that was noted in this one review of forensic interviewing techniques that was shown to be effective, that really giving time, that this isn't going to be a one session, and that it may be multiple sessions. And again, anything that is similar to what would occur in a child advocacy center. Of course, we know, especially in the States and now in Canada, that we're seeing a lot of evidence that these centers really use the kind of techniques that help with disclosure. I have another question I want to get to. Can you talk about recanting when kids take back their disclosure? Another really important question. I think that recanting, both from my experience but also from the research, really is evidence that the safety wasn't there for the victim or the survivor to proceed. And it may not even be anything that you're doing or not doing, but it may be something that's happened in their life or in their environment that has, it's like there's this kind of weighing up of, how safe is it to tell and what are the threats? And as soon as the threats outweigh the safety factors, then I think you can expect that anyone, and especially these youth, would recant because the danger level becomes too much. I have another question about any tips or tools you find helpful for diffusing parents. I do most of my work with parents where there's been child sexual abuse. And I'm not sure if these are parents where there's extrafamilial abuse, but, an intrafamilial abuse would be something different. But in extrafamilial abuse, I think giving them time and psychoeducation. I think really giving parents information in a logical way and letting them sit with it can be one way to diffuse them. And when we say, the term you're using is diffuse, so I'm assuming that there's a lot of high affect, a lot of emotion dysregulation, because even with parents who may not be involved in the abuse, they feel terribly guilty that they weren't able to detect it, or perhaps they put their child in contact with someone who ended up being an abuser. And I think that defensiveness and that guilt, that sort of high affect and not being able to regulate it is what happens. And giving information and using logic to counter that kind of high emotion can help with parents. But it's not going to work with all parents, depending if they have their own trauma history. And I think that takes time to get at, but either a trauma history will act as an asset for a parent in a disclosure to their child's disclosure, or it can be a real liability if those issues have not been worked through. So again, a trauma-informed perspective is really important with parents. And the thing about a informed approach is you assume there's been trauma when there hasn't been a disclosure. There hasn't been anything that's been said, but these parents might be reeling from their own historical trauma, which is then colliding with what's happened with their child. I have another question. What strategies are most effective or useful when informing children, youth about duty to report? And explain the process, informed choice, how to explain in the moment. One of the things that I find, and I use in my classes as well when I'm teaching, I teach social workers preparation for practice, but that this has to happen really early, and there has to be reminders of this duty to report. And some of the most skilled clinicians that I've worked with really weave this in throughout their counseling as reminders, and almost explain and re-explain what would happen, but also counter that, because of course the youth will say to themselves, well, why am I going to tell things I don't want anybody to know? Everybody will know then, my family will be, imploding. And that over time, the counselor can say, yes, reporting this to Children's Aid might be really scary, but let's look at what's potentially happening if you don't, or if one doesn't. And again, you can put it in the third person so that particular youth isn't feeling like they are being coerced into a disclosure, because that's another thing you want to avoid, you don't want to get into. But that over time, they will know what will happen, but they will start to develop their own strategies about how to deal with what will happen. And it won't come as such a unexpected event. So I think this telling early in the relationship with reminders and really unpacking what it would mean for someone, again, putting it in the third person to tell, and how could they handle or develop strategies for what might happen. I've just been signaled that we are at the end of our time. I know we have a few more questions, but I think we have to keep it to it. And I thank you very, very much for taking the time to listen to my talk and to give thought to some of the points that I've been raising.